Hello, I'm Dr. Jimmy Douglas, and today we'll look into the steps you should be taking to prevent piles. Let's get started. Being constipated and incomplete evacuation of feces are the earliest symptoms the patients notice, and care has to be taken from that time to follow habits which help in preventing piles. So our primary aim would be to make the feces soft so that it can be easily evacuated. We have already seen the causes which leads to piles, and to avoid these you have to take the following steps. You would be straining because you may be constipated, and most commonly it is due to your irregular bowel habits. When you have the urge to defecate and you postpone it, the stools remain inside for longer duration of time and the water is absorbed, making the stools harder. To make the stools softer, you have to increase your daily intake of dietary fiber along with water, and the chances are you are not consuming your daily requirement of dietary fiber. While the daily requirement for men is 30 to 38 grams, while for women is 21 to 25 grams. What the dietary fiber does is it helps in increasing the formation of bulk and soft feces, which eases defecation. And remember to drink enough water as you increase your dietary fiber intake. Dietary fiber also helps in reducing cholesterol and incidence of gallstones. It has antioxidants, help in diabetic patients also. You would be getting over-the-counter dietary supplements, but intake of dietary supplement should always be accompanied by increase in water intake, because if you don't do that, it would make your condition worse. Make a list of fruits and vegetables which you like, which contain high dietary fiber, and have them regularly. Remember to have at least one vegetable every day, and alternating with beans would be very helpful. We have given the details in the description. While avoiding red meat is important, you could consume chicken and fish. And also, after consuming, it's very important to drink enough water. We have heard and known people who spend a lot of time in the washroom. Whatever they might be doing in the washroom, they should not be sitting on the toilet and straining. While 2.7 to 3.7 liters per day is the adequate daily requirement for adults. You should be consuming water over the duration of the day and should not be consumed in a short time. If you can't drink water, then fluids in any form can be taken, such as buttermilk, juices, but avoid carbonated drinks. Having fruits is always better than juices, because when you prepare juices, a lot of fiber is lost. So you should be knowing which fruit has how much dietary fiber and consume accordingly. Not just fruits and vegetables, but your overall health has to be taken care of by walking regularly for 30 to 45 minutes every day. Sedentary lifestyle not only increases the risk for piles, but also for heart disease and diabetes. When you cough or sneeze, you can feel the pressure exerted by the vascular structures around the anus. It keeps the anus watertight. And the same thing happens when you're lifting heavy objects. And if done frequently, the pressure exerted would be constant and overbearing. That may give rise to piles. Now, click on the subscribe button and share the video. Next video is on diagnosis of piles. Thank you for watching. See you in the next one.